enter the room.
Good morning, I'm Dr. Kamarali. My GMC number is 1234567. May I proceed, please?
Please proceed.
Thank you. Hello, good morning.
Hi, doctor.
I'm Dr. Ali. I'm calling from the orthopedic department at Manchester Infirmary. Could I confirm who I'm talking to, please?
Yeah, I'm Jack.
Could you confirm your full name, please?
Yes, Jack Reacher.
Thank you so much. And just to make sure that I have the right records with me, could you confirm your age and first line of address, please?
Oh, sure. I'm 45 years and my address is 83 Softbank Road, Manchester.
Thank you so much. So I'm calling you today because I have something to discuss with you related to the blood sample that we took yesterday. So is it a good time that we can have a chat now?
Yeah, sure, doctor. Yeah, it's a great time.
Thank you.
Yeah.
Before proceeding further, I understand that you've been scheduled for a knee replacement surgery. Am I correct?
Yeah, that's right. Yeah.
And okay. And could you tell me when will the surgery be taken?
In about 2 weeks.
All right. And how are you feeling now?
Yeah, I'm all right, but yeah, surviving, managing with painkillers.
I understand. And could you tell me what first happened so that you were scheduled for the knee surgery? What symptoms did you have?
Oh, I actually had a PCL injury, so yeah, they said it would be important to get a knee replacement for that.
I understand that. And how does this impact in your life?
I mean, it's difficult for me to walk. I'm always in pain. So
I totally understand that. I'm sorry to hear about that. Mr. Reacher, just to check some information, do you have any long-term medical condition?
no, doctor.
No. Are you taking any medications?
Nope, no regular medication.
All right. And are you allergic to any medication?
No, doctor.
No. All right. Have you by any chance been diagnosed before with any bleeding disorders, or have you been taking any blood thinner medication?
No, doctor.
Okay. And do you have any family history of any bleeding tendency?
Nope.
All right, thank you. Could you just walk me through what happened yesterday when they took the blood sample from you?
Well, I believe they just took the blood. It was a pretty bad experience if you ask me. I think I have a needle phobia, and the whole process was a little bit rushed, I feel.
I totally understand that. So did you have pain?
Yeah, incredible.
Yeah, I understand that. Okay. All right. So, Mr. Reacher, as I told you, I have an information that I want to discuss with you. First, I really understand that the procedure is really important for you, and unfortunately, I'm sorry to tell you that the blood sample we took yesterday, it was not labeled correctly. And today we received a call from the lab, and they told us that they cannot run investigation on this blood sample, so they discarded it. I'm really sorry to tell you that.
What? What do you mean they discarded it? What do you expect
So
me to do about that?
I totally understand that must be really frustrating for you, and I'm really sorry that you've been through this. But the sample, it was not labeled, so we need to get another sample from you just to run the investigation.
If you didn't label the sample, that's your problem. I don't want to come in for such a procedure again. Like I mentioned, it was a terrible experience. I don't think I want to do this again. Do the surgery without it.
I totally understand that, and I sincerely apologize about the inconvenience and about the mistake that happened. But Mr. Reacher, I understand that the surgery is important, and unfortunately, we cannot risk on taking and doing the surgery without a proper investigation early on.
So you expect me to undergo that same experience, all because you people can't, label a blood sample properly? That's not my problem, doctor. I mean, I have to take time off of work and all that. Who's going to manage my work schedule? You people can just lose your sample and you can, make me come in for multiple samples like this.
I totally understand that, Mr. Reacher. I totally appreciate your time that you had to take to came into the practice, and I understand that you had to take a lot of effort to come here and also to take time from work. And I sincerely apologize about this inconvenience. But and I understand that this is a mistake on our part, but the test is really important. It's important for the surgery. So do you think that you might be
2 minutes
able to
remaining.
take some time out from the work, and we can totally make time that suits you if you can do that?
I mean, I have to suffer because of your ineptitude and your negligence. I mean, this is not fair, doctor. I'd like to make a complaint. I want to make sure that this doesn't happen to anyone.
This is your total right. We can refer you to the patient advisory liaison service. You can complain about that, and I understand this is your total right. We have other things that we can offer to you. Maybe if you cannot come to the hospital, what do you think about going to the GP and give your blood sample there?
Yeah, I mean, I still have to take time out of work for that. I'll have to discuss it with my manager.
I
But
understand.
I'll anyway have to go through that sort of a bad experience again. I'm not really looking forward to that, doctor.
I totally understand that, Mr. Reacher. We can make this experience more comfortable for you. I will make sure that when we take the sample, we try our best to make it not comfortable. We will make it as easy as possible for you. I totally understand. I will appreciate it if you can understand the situation. So do you feel you can give it another chance?
Well, now I have to. How do I make sure that this doesn't happen again?
We will write a formal complaint and we will document this incident, and I will make sure myself that this will never happen again, not to you, not to any other patient. So how does this sound to you?
Yeah, that's some step. Yeah, that's a few steps you can take. Sure.
Okay. All right.
So,
What other? What?
Move on to the next station.
I think I kind of had I finished my questions there. But good job.
You're so angry.
I mean, I would say be prepared for that. Your angry patients are going to be angry.
I thought at some point you were gonna hit me.
But I have to
Thank you
say,
so much.
composure. I know. I'm so sorry for that, but
That's totally fine. Thank you so much.
but good job, Dr. Kamar. I have to say, I mean, that was a great performance. I mean, you did keep your cool.
I tried my best.
And this is exactly what I was talking about, angry patients, the station is really difficult because they tend to throw you off. They actually act perfectly. So usually these cases come in two formats. So this is angry after disclosure. So when you actually disclose the news that can, make them angry, they tend to become angry after. But there is also a situation when they can be angry from the beginning, right? So right at the beginning of the station, they'll start with screaming at you, like, I've been waiting for so long, or, if it's, maybe there could be a patient who's come with a, a cyst, a post-operative, infection. So they're really angry about that, so they'll, as soon as you enter the station itself, they start screaming at you, So a good way to actually, get your composure back is by, facing that emotion right away. As soon as they come in angry, mention it back to them. I can see that you're angry. I can see that you're upset. Could you tell me a little bit more about why you're feeling this way? So that will give you some time to collect your thoughts and get your composure back. And then you can start with your round of questioning by understanding the incident, understanding what went wrong, and then offering them support accordingly. Yeah. But good job, I have to say. All right, so Dr. Mishi, were you able to mark this?
Yes, I was.
Thank you so much. All right, let's take a look. All right, not bad. Good job. Yeah. So let's look at all the covered points. Confirm the name, identity, date of birth, or address. So most of the times, the sheet for the date of birth or the address will be provided to you so that you can actually confirm it, right? So unfortunately, we don't have that. But in the real exam, these are information that will actually be provided to you. Telephone etiquettes, that's very important. So even before going into the main consultation, you have to make sure that the line is clear. And, one extra thing that you can add to this is, what happens if this line were to accidentally drop, right? So, you can presumptuously actually prepare for that, just in case if this line were to disconnect, is this a number that I can get you back on, right? So that's also something you can add to your telephone etiquettes. Confirm if it is a good time to talk. Is it a good time to talk? Clarify the reason for the pre-operative assessment and confirm the upcoming surgery details, right? Good job there. Ask how the patient is feeling today, right? In the current condition. Explore the patient's experience during the previous blood test. This is very important because understanding this experience, you can give them a little more, tips of how you could have improved. Right. So this patient was like, I felt this was a little bit rushed. Right. So you can actually talk about the fact that this time we'll make sure that you don't feel that rushed. Understanding these words, because this is the main thing that you have to discuss with them. So understanding their bad experience and trying to rectify that in your management, that will be very good. That will be very essential there. So this is a very important question for you to understand in formulating your management plan. All right, confirm any past history, medical condition, confirm any regular medication, over-the-counter remedy, check for allergies, medication, latex or antiseptics used in the bloods, in the blood draws. So you asked me this question twice. The first time you asked me, do you have any medical condition? And then you asked me, do you have any condition that affects your blood or, any family history?
Yeah, I was trying to be more specific because I asked general if you have any medical condition. Then I asked specifically about any bleeding tendency or.
Yeah. I mean, I understand that's great, but especially in PLAB 2 when you are a little short of time and there are just 8 minutes. So it's a good practice to ask, do you have any medical conditions, especially related to blood or any clotting disorders? So you can actually get that answer in one go rather than asking them twice. Yeah?
Yes, yes, thank you.
So because again, you'll have to be, because that's what, no, you made it into 2 questions. So is that essential for you to make it into 2 questions? Will that actually affect your data gathering marks? So try to ask very limited questions because that time runs out with every question that you ask, right? So keep a mind of how many questions you're asking. All right, so he asked about, he mentioned that I think I might be having needle phobia. So as soon as he says things like I have needle phobia, and the next thing you're going to ask him is for another, another appointment for, drawing more blood. So definitely you would want to, you want to explore a little bit more about this needle phobia, like, could you tell me a little bit more about it? Like, why do you feel you have this, right? So to understand, so accordingly, you can give them management. Right, you can talk them through the process, ask them for some scoping strategies. You can, give them a squeeze ball so that they can squeeze it while the procedure is happening to distract them, to understand exactly what the phobia is. Right, if it was pain, you can give them some numbing creams before the procedure itself, right? Explore work and personal commitments that may make attending another appointment difficult. So your main task is to ask him to come in. So anything that could restrict that from happening, you need to explore those things, in data gathering, like you're going to be asking him to come in. So will he have adequate time, right? What is his work and, the demands of his work? Will he be able to come in for another appointment, right? So accordingly, you can understand that from beforehand, but that's okay. That it came in the conversation later on in management itself. But yeah, let's look at the management. Explain the issue, Mr. Reacher. The reason I'm calling is regarding your blood test from yesterday. Unfortunately, there was a mistake on our end. The sample wasn't labeled properly and the lab hasn't processed it. Explain the necessity of the blood test. It is essential for the surgery to get these blood tests to keep in keeping with the protocol to collect baseline levels and also ensuring there are no underlying issues that could hinder the surgery. Yeah. So this is also another important point, right? Why are you collecting the blood tests? To understand the baseline level and also to understand if there are any conditions that could, seem complication, that could lead to any sort of a complication during the surgery, right? But yeah, I think I'll also give you marks over there. Offer alternative locations. If visiting the hospital is difficult, we could arrange for you to give the sample at your GP office, or perhaps arrange a home visit as well, right? Because this is your fault technically. So you have to make sure that you do everything in your power to get that blood test, because he has lived up to his end of the deal where he came in for the blood testing and he gave his sample. Now you've lost the sample, so technically it's your fault. So you're trying to make sure that you somehow accommodate his schedule into your process. So try to offer him more ways in which he agrees. So somehow you have to get him to agree by the end of his station, right? So these are a couple of things that you can offer him. So I'm going to give you a partial for this one, but yeah, that checks out as well. Use numbing agents for needle phobia. I'm not sure, did you mention this part?
We said that we will try to make it so comfortable this time, but I didn't specifically say numbing agents.
Yeah. So you can actually, so in the data gathering itself, you can understand, what the needle phobia is, what exactly, do you mean by that? Why do you feel this way? So if it's the pain, then you can actually give the numbing agent. If he needs a distraction, you can talk him through the process, right? So this time we will take extra precautions so as to reduce your discomfort with numbing agents, even talk you through the procedure due to your needle phobia, right? That's something you can offer. So I'm going to give you a partial for this one. So file incident reports. An incident report has been filed that will be conducting a thorough review to prevent such mistakes from happening in the future. Safety netting, provide contact details for further for questions, arrange follow-up calls to confirm arrangements, and offer PAL contacts for complaints, right? Otherwise, partially covered. Apologize for the inconvenience. I deeply apologize for this inconvenience. I understand how upsetting and frustrating this must have been, especially since you've already taken a significant time off for your surgery. Yeah. So that's also an important aspect, right? That 2 weeks later he's having his surgery. So definitely he has taken a certain amount of time, for his surgery. So understanding that aspect is also kind of important, because you're asking him to come in for another day and do this procedure, right? So explore and understand his emotions with that, right? Ensure correct labeling. I will personally ensure. So these are things that you can actually offer. I will personally ensure that all the samples are correctly labeled and delivered to the lab on time, right? Offer flexible solution. Would it be possible for you to come in after work hours? What time do you usually finish work, right? To understand a little bit more about how you can accommodate this, right? Offer transportation assistance. If transportation is an issue, we can arrange a taxi or a transport for you. Reassure about further prevention. We take these incidents very seriously. We have reviewed our procedures to, we will review our procedures to ensure this does not happen again, right? Coordinate next steps. If you need time to think about it, it's perfectly fine. Can I call you back in an hour, or would you prefer to call me, right? Because he may have to move things around, right? So give him that flexibility. Follow up, thank you for your understanding and cooperation. We understand your help. We appreciate your help in ensuring your surgery goes ahead smoothly. Right? Finally, interpersonal skills, empathy and support. I'm really sorry for the inconvenience this caused you. This was our mistake, and I understand how frustrating this must be, especially given your busy schedule. So always own up to the fact that it's your mistake. So when a mistake is happened and you actually know that it's your mistake, be very transparent about that fact, right? There might be situations where you would not know whose mistake it is, right? So apologize, for the way they're feeling. I apologize, that you're feeling this way. That way, you're not actually blaming anyone. But if you actually know that this was a mistake on your end, you can actually offer up apology accordingly, right? Simple language, explain the issue in layman terms, check understanding, ensure patient comprehends the discussion, invite questions. Patient-centered approach, involve patient in decision-making about the timing and location of the blood test. Begin with a polite, calm greeting and maintain respectful tone throughout. Yeah, that's very important, because usually when the patient starts screaming, a lot of people get thrown off. They don't know how to react. They may also come up aggressively. So good job there. Partially covered, acknowledge patient's feeling. I can understand why you're upset. Any person in your situation would feel the same way. Yep. Miss Risha, offer hope for a smooth surgery with proper preoperative assessment. Summarize agreed plan at the end and thank the patient for his cooperation. Yeah. So this is if you manage to convince him. If you don't manage to convince him, you give him the flexibility option. If you need time to think about it, it's perfectly fine. I can call you back in an hour, or would you prefer to call me? It depends on how the situation goes. But good job, Dr. Kamar. That was very well done.
To practice this case with AI, please visit TuringMedSchool.com.